Hello, my name is Chase Baker. Today I'm going to be talking about diabetes mellitus type 2. In 2016, an estimated 1.6 million deaths were directly caused by diabetes. Another 2.2 million deaths were attributed to high blood glucose in 2012. The World Health Organization estimates 30 million adults have diabetes and 84 million adults are living with prediabetes. That's 1 in 7 US adults that have diabetes type 2. So we're going to be going over what is metabolic disease, the history of diabetes type 2, mechanism of diabetes type 2, current treatments, and what the future of this disease looks like. So in the top left corner, you can see what a healthy, normal example is of a pancreas. So the pancreas has beta cells, and inside those isolates of Langerhans, you have those beta cells that release insulin, and insulin is released in response to high elevation of blood glucose after you eat a meal. And so the insulin receptor binds to the cell, and that allows glucose to be transported and uptake and leave the blood. Type 1 diabetes is an autoimmune disorder, and this is not what we're going to be talking about today, but I want to make you aware that this is where you are insulin dependent 100% because you don't make insulin at all. And then we have type 2 diabetes in the bottom left, where you make insulin, but the receptor has low affinity for it. And so you have trouble uptaking glucose out of your bloodstream. And a metabolic disease is really any disease or disorder that disrupts normal metabolism. The process of converting food to energy on a cellular level is interrupted. So symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset, and after complications may have already arisen. Until recently, this type of diabetes was seen only in adults, but is now also occurring increasingly frequently in children. So type 2 diabetes was formerly called non-insulin dependent or adult onset. Results from the body's ineffective use of insulin. The majority of people with diabetes have type 2. The type of diabetes is largely the result of excess weight and physical inactivity. So now we're going to be looking at the history of diabetes. So diabetes has been affecting lives for thousands of years. An ailment suspected to be diabetes was recognized by the Egyptians in manuscripts dating to approximately 1550 BC. And according to one study, ancient Indians 400 or 500 AD were well aware of the condition and had even identified two types of this condition. They tested for diabetes, which they called honey urine, and this was to determine if ants were attracted to a person's urine, and this is due to high elevation of glucose in the blood, also has high glucose in urine, and so your urine smells and tastes sweet to the ants. Next, we have the father of diabetes. In the early 20th century, medical professionals took the first step towards discovering a cause and treatment mode for diabetes. In 1926, Edward Albert Sharpe Schaefer announced that the pancreas of patient with diabetes was unable to produce what he termed insulin. Physicians promoted a fasting diet combined with regular exercise to combat this disorder. And despite attempts to manage the disorder through diet and exercise, people with diabetes inevitably died prematurely. And in 1921, scientists experimenting with dogs had a breakthrough, reversing the effects of diabetes. Two Canadian researchers successfully extracted insulin from healthy dogs, then injected it into dogs that had diabetes to improve their condition. So insulin is a hormone made by your pancreas, as you know. It allows your body to use glucose for energy. Glucose is a type of sugar found in many carbohydrates. So this is the mechanism of diabetes. There is so much to know and so much to cover. This isn't to scare you. It's just to let you know that there's a lot I'm leaving out when it comes to the mechanism, but I'm going to give you a short description. Through this animation. So insulin facilitates glucose transport into cells. insulin receptor binds insulin and initiates a series of events causing glucose transporter expression and translation. These transport proteins migrate to the cell surface, allowing glucose to enter the cells. Once intracellular glucose molecules undergo phosphorylation in order to make ATP for metabolic use. And in type 2 diabetes, the glucose insulin balance is disrupted, usually from decreased physical activity or excess weight. And over time, insulin receptors become resistant to insulin. As a result, fewer glucose proteins transporters are activated and decreased glucose uptake into the cell. The pancreas must upregulate insulin production to import glucose more effectively, and over time the pancreas becomes less efficient at upregulation of insulin, and plasma glucose levels rise. The diagnosis of diabetes is then made. So what type of treatments are there for people with type 2 diabetes? So there is a lot of medications that have been made in the last year that are inhibitors, blockers, sequestrants, and people who have type 2 diabetes can achieve a target blood sugar level with diet and exercise alone, but many also need diabetic medication or insulin therapy. Insulin has been available since 1925. It was initially extracted from beef and pork pancreases. In the early 1980s, the technology became available to produce insulin synthetically. And synthetic human insulin has replaced beef, and analogs are replacing human insulin today. And so there's 5 types of insulin for a wide variety of reasons you would need insulin. And then the long-term treatment would be diet, exercise, and healthy lifestyle choices. And you do not need insulin for the majority of a diabetic's life if these things are managed properly. So is there a cure? Like a lot of diseases, there is a lot of great technology coming out. Just in the past decade, scientists have realized that the microbes living inside us and on us play a role in our health. The human microbiome, and especially the gut microbiome, has been linked to multiple chronic disease, including diabetes. An unbalanced microbiome composition has been found in patients with diabetes who tend to have less diverse gut microbiome as compared to healthy people. Researchers at the University of Amsterdam showed that fecal transplant used to transfer the microbiome of a healthy person to the gut of one with diabetes can result in short-term improvement of insulin resistance in obese patients. And then what about robots? So the diabetes market is expected to reach a massive 86 billion in 2025, combining type 2 diabetes and type 1. And we can expect all sorts of revolutionary technologies to come forward and claim the market share, but researchers have already speculated microchips can be used to diagnose type 2 diabetes before symptoms appear, and nanorobots can be used to travel through the bloodstream while they measure glucose and deliver insulin, and these patents are already underway for the next 10 years. So now that we've looked at diabetes type 2, we understand that metabolic disease plays a role, the history of it, the mechanism, the treatments, and what the future of diabetes looks like. How can we make a difference? The prevalence of diabetes type 2 will increase 54% in more than 54.9 million Americans between 2015 and 2030. Annual deaths attributed to diabetes will climb by 38%. That's 385,800 people. And a total of annual medical and societal cost related to diabetes will increase 53% to more than 622 billion. If the incidence and prevalence of type 2 diabetes in children, as you see in this chart on the left, it's an obesity chart, and obesity is highly correlated with development of type 2 diabetes. And as children get heavier, type 2 diabetes is going to increase in youth. And so the burden of diabetes and its complications will affect many more individuals than currently anticipated. And the cost of diabetes to our society will cause us to consume enormous resources. Also, many more Americans will be taking potentially potent medications which have risk that they'll have to be on for the rest of their lives. So some things we can do are check your risk level, visiting your doctor, managing your weight, exercising, eating healthy, quit smoking, limiting your alcohol intake, visiting your physician regularly, and educate their friends and family around you about health and diabetes. And most importantly, voting so that we all have equal access to healthcare in the future. Thank you.